Yeah.
So Rick, what we're gonna do is, and anybody who has any questions for Rick, please put it into the chat. In the meantime, I think Robben, you said you had some questions that you had prepared, and I think Chip after you. So we're gonna give it to Robben to ask you some tough questions and play Stump the Boss.
That's right. Well, I've got some easy ones here first. This one was a question on the new person wanted to put drops in her drinking water, but it's her well water, and it's a really good well water. They have it tested and all. And so she just wanted to make sure it wasn't going to take the minerals out of the water, the good minerals that she needed in her water.
Well, even if it did, you're still swallowing that water, and those minerals are going to be exchanged for heavy metals and toxins in your body. So that really doesn't matter. I will tell you this, that it's kind of funny that you can really tell bad water when you add the zeolite to it, because if you have, say you have heavy metals in your drinking water, those metals are usually coordinated. They work as a salt. So say you have, I don't know, magnesium chloride or calcium chloride is in your water. When you add the zeolite drops to the glass of water, it's going to trap the counter ions. It's going to trap the calcium or magnesium and free that up. And it's going to free up the counter ion, the negative ion, which is in that case, chlorine. So people say, there was something wrong with your zeolite. I added it to my water and my water smelled terrible. Well, that's because now it's off gassing the counter ions. It's off gassing the chlorine. It smells like chlorine, even though it was just naturally calcium chloride or magnesium chloride or stuff like that in the water. So for the most part, you can tell if it's unfiltered well water, chances are something like that will happen, But I say if you're in a restaurant, you add to the water, you smell a little something, that's what's happening. Now, that being the case, even like I said, even if it's trapping magnesium, calcium, anything positive that's in the water, it's going to exchange those out through cationic exchange once it gets in your body. And the smaller ions, the higher charge, all the heavy metals are eventually going to exchange out the zeolite for the good stuff. Cool.
Okay, we've got Frank has a special friend that is 30 years of age, has an autoimmune disorder that makes it, this is a stumper, I think, maybe, that makes it hard to get pregnant, and then another one that attacks her body and even the fetus, causing her to lose the infant. Is there research that shows our Daily Detox Plus can correct this disorder?
Well, I know exactly what disorder is, but the product is immunomodulatory, and there's been publications of the immunomodulatory nature of zeolites, many different zeolites. What that means is it allows the immune system to work more efficiently, and it does it through a variety of different mechanisms, even just the reduction of heavy metals. Get in the way of metalloproteins and metalloenzymes allows the immune system to work better. Now, one of the dangers of stimulating the immune system is you have something called a hyperimmune response, where the immune system becomes the danger. If people have heard when they get COVID, there's the second stage of COVID, which is the chemokine storm or the cytokine storm. That's because you have a hyperimmune reaction and your immune system now is causing damage. Well, in the presence of the zeolite, the immune system is modulated. So you have a good immune response, but not a hyperimmune response. And I have given this, I've been working with multiple sclerosis patients for over 20 years, and I give every MS patient zeolite. I've given them for forever as part of their protocol. And there's other things I'd recommend, and there's other things I would actually recommend for Tricia if she wants some additional recommendations. But certainly, the zeolite is going to help improve total general health and act as an immunomodulator to prevent damage from the immune system. If you know exactly what she's been diagnosed with, I might be able to go a little deeper into it. Certainly preeclampsia is what normally happens, but that's not autoimmune in most cases. But preeclampsia can lead to high blood pressure and loss of the fetus.
I know we've got some questions coming in. I'll let Neil deal with those that are coming on the chat. Just real quick, would you review again the reason to do the detox after a lengthy surgery? And I would say before a lengthy surgery, actually. A 12-hour surgery brought this question up.
Well, I mean, I say do the detox all the time. Certainly, there's lots and lots of things that happen during surgery, including all the medications you're using. And a lot of those medications are dangerous in and of themselves, and they also have downstream metabolites, which is why a lot of times, even after surgery, you feel terrible for 30 days, 60 days after surgery, because a lot of times it's the body trying to clear itself of some of these things. Also, if you had a pre-surgical workup, a lot of times that includes contrast agents for things like MRIs. And the contrast agents are usually heavy metals like gadolinium. And you want to try to get that stuff out of the body too, because that has long-term negative effects.
Great. Awesome. Okay. I have some, I'm going to ask those all together here in just a minute. I've got one. Michael just was telling me, one of our Navan family, that he's going in for a scan because the doctor's is thinking that he's possibly has a tumor in his head near his ear that's causing tendinitis and blocks the ear canal. That's something that you could kind of address a little bit for him and what he
Right.
might
Well,
take.
yeah, there's all sorts of forms of tinnitus, which is ringing in the ear. Okay. And there's all sorts of causes of it. It's actually two families of thought when it comes to tinnitus. And you have something called audible and inaudible tinnitus. Okay. Audible tinnitus is other people can hear it. So that's really important. So if you have ringing in your ears or sound in your ears, ask someone else to put their ear against yours and see if they hear it. Okay. If they do, that's about 40% of cases. That's circulatory. Okay. That means you have some circulatory problems. You have additional blood vessels. You have impinging on blood vessels in and around the ear that's causing this. And there's ways to treat that. If it's inaudible tinnitus, that's neurologic. Okay. You're hearing things that really aren't there. And it's because you're stimulating the nerves. And that's a whole different way to treat it. Okay. Now, depending on what his is, you could have a tumor that's impinging, either causing pressure on the blood vessels, which causes audible tinnitus, or pressure or pinching around a nerve that's causing neurologic tinnitus. Either way, I'm telling. I hate to say the zeolite is good for everything, but it is. It helps the body basically fix itself whenever possible. It allows for metabolic processes that are normally supposed to take place. If it is in fact a tumor, obviously he should know about that, get it debulked and removed if it's possible to surgically remove it. I have said before, we don't talk about being a treatment for cancer, but there have been several studies done with the zeolite as an adjunct to radiation and chemotherapy, where it's been shown to induce apoptosis, to actually help in reduction of side effects from chemotherapy and radiation through a variety of different mechanisms. So certainly it can't hurt and is probably going to help. But I would say first, after he has a scan, whether he's getting just an MRI or a SPECTRA scan or a PET scan, to try and figure out exactly what's going on, and I can give better advice.
Okay, I have just a couple more I'm going to put together here. Does it matter if you put the zeolite in hot or cold food, water, that kind of a thing? Does it bother the zeolite? Also, if someone's taking essential oils, will it interfere with the pH balance? Will they interfere with the pH balance that the zeolite's trying to correct in the body? And then bone spurs.
Okay, that's all. You're all over the place. All right, hot and cold doesn't affect the zeolite. The zeolite is incredibly stable, one of the most stable compounds on the planet. It can survive over 900 degrees for more than 5 hours. It's also amphoteric, so it exists just as well in strong acid as strong base. It's really, really, really hard to mess up the zeolite. In fact, I talked about this before. After the Chernobyl incident, the first thing he did is they dropped 3 tons of clinoptilolite on the Chernobyl reactor to try and prevent more radiation from spreading. And then they gave sacks of clinoptilolite mixed with flour to people all over Russia and all over Ukraine to bake with. And they made biscuits with the clinoptilolite, and they used it in animal feed to force the removal of radiation, increased radioactive excretion by 15-fold when they ate food cooked with the zeolite. And so, yes, it's absolutely, you can cook with it. You can do anything. You can put it in hot and water and cold. It's not going to change the effect. Get it into your body. And the other proof for us directly with this product, it was the West Virginia coal miner study. We had these coal miners use the zeolite. We said, take it any way you want. Put it right in your mouth, put it in food or drink, whatever you want. But we want you to be consistent in the way you take it and tell us how you did it. And it didn't matter how they took it. They all got the same benefit against the placebo patients. So we know it actually worked. It was a double-blind placebo-controlled study. And there were people that added to their coffee. They put it on their food. One guy added to his mashed potatoes with dinner. One guy, I said this before, put it in his scotch every night. He had a glass of scotch. And he had his scotch every night. And he still got the same benefit. So the trick is get it into your body. However you get in your body, it's going to be beneficial. All right. So What do you say before bone spurs? What was the middle
Okay,
one?
sorry, I knew I was going to do that to you, huh? If someone's taking essential oils, is it going to interfere with the zeolite, the pH balance of the
Right.
zeolite gene?
Essential oils is a wide range of things, you know. But as a rule, I'm going to say no. There's no real interaction. Essential oils, by definition, are lipophilic. They're oil soluble, and the zeolite, even though it's insoluble, it's not lipophilic. It's hydrophilic. So it works with charged particles, positives and negatives. So it's not going to have any interaction whatsoever with oils, you know. Um, and the oils themselves, the only thing you would worry about would be volatile organics, which are flat compounds like benzene type products, and those wouldn't be in essential oils anyway. All right, then you asked about bone spurs. Listen, I don't know particularly about bone spurs. There's all sorts of causes of bone spurs, including genetic predisposition for deposition of bone spurs. But I will say that we've proven that the zeolite helps by preventing calcium deposition, especially kidney stones. So people who are kidney stone formers, when they take the zeolite, they're much less likely to form kidney stones. And we believe it's because it helps shuttle the calcium and magnesium around the body. So whereas the zeolite doesn't like calcium, it's not going to hold on to it and excrete it from your body. Calcium will migrate into the zeolite along with all the other metals, but it's going to migrate in, then the zeolite's going to float around the body, and there's mercury or lead or something that has a higher affinity for the zeolite, and it'll grab the mercury and lead and drop off the calcium. By doing so, it actually keeps a lot of these healthy metals in circulation where they're much more usable, which is one of the other side effects of the zeolite. By keeping all these things, all these nutrients in constant circulation, they get to the parts of the body where they're most necessary.
Awesome. I've got one more if I want to turn it over to Neil here. And this is from Claudine in UK. So I want to make sure we got it. She wasn't sure she's going to be able to stay up to be on the call, but she'll get the recording. She wanted to know, she named a company and I'm not going to name it, but tell us why our zeolite, your zeolite is the best. And, you know, just explain that, Rik, on this call. I think it's important anyway. Everybody needs that.
Yeah, I was the category creator. There really was nothing like this before my products came in 2003, 2004. There was one product in the market in Europe called Megamins, and that was simply powdered zeolite in a capsule with some vitamin C. And it was an interesting product, and I read their research, and they actually wanted me to come and work with them and help them with their product when I just decided to do stuff on my own. There was also a product called Estefan in Cuba that made it to the United States for the treatment of diarrhea. And basically it was just a bunch of zeolite. You would take like 6 capsules at a time. And the zeolite's really hygroscopic. It loves sucking up water. And so it just makes a block in your gut and prevents diarrhea. So when I first came up with my concepts of why it was wrong, what was wrong with it, and I came up with the micronization activation, we were so successful. If you remember, when we first launched the product, I mean, within months, we're selling like millions of bottles of this. And so the testimonials were out of control. They were everywhere. But that triggered all these knockoffs. 20, 30 companies started knocking us off. And I'll never forget, the very first company that knocked us off was Denali. And they had a product called Denali Tox. I don't even know if they're still in business. But I can't tell you how many people called me and said, Rik, you have to review Denali. You have to take samples of the product and you have to analyze it. And I say, well, listen, you don't have to swing at every pitch. There's a lot of low-level competitors out there. And just us recognizing that they're out there gives them credibility, gives them credence, okay? And this particular product was terrible. First, they added humic and fulvic acid to it. And you're going to see a lot of zeolite products that have humic and fulvic acid. So what are those? So if you've ever heard of humic earth or humus earth, that's basically compost. It's all the dirt and all the stuff you put together, and then it's got to break down. So what breaks down plant material and fungal material? It's always bacteria. It's fungus and bacteria that breaks down that plant material. And so when you get humic or fulvic acids, it comes from humic earth. By definition, it's got bacteria and fungus in it and can have fungal particles in it like aflatoxins, okay, which can cause permanent liver damage and liver failure. So the reason they put those humic and fulvic acids in it is that the zeolite is not micronized. They haven't micronized and activated the zeolite. So if you look at a bottle of Daily Detox Plus, yeah, you'll see over time it'll fall to the bottom. But even just shaking a little bit, it goes immediately back into solution and stays in solution. That's because it's micronized as a colloidal suspension. Their stuff is so big, it doesn't, you got to shake it to try and keep it in solution, and then it falls out anyway. And so the humic and fulvic acids are so highly charged. They have so much positive compounds in it that it holds the zeolite in solution. It's a trick. It's basically a trick to try and keep their product in solution so it doesn't look like a clump on the bottom of the bottle. Meanwhile, a lot of those aflatoxins are dangerous, and we saw that with the Denali product. So when that product came out, I refused to comment on it at all. But the first thing that came out was it turned your teeth green when you took it. I consider that a negative. I don't know about you guys, but we all want white teeth, and it turned your teeth green. The second thing is it put 5 people in the hospital with liver failure from aflatoxicosis, which I warned people about based on humic and fulvic acids. So right after that incident, the president of the company was fired. They discontinued the product. That was the first real competitor to my product. And since then, there have been a lot of other products, and they get it wrong so many times. There's one product out there now that says, I micronize my zeolite. They nano size their zeolite, nano. So they're better because they're nano. And I hate when people try to use marketing terms, because I could say, hey, I'm nano sized. I'm 32 trillion nanometers tall. Okay. So it doesn't make any sense to say nano versus micro. Okay. They also, in their advertising on their website, they say their cages are 0.9 nanometers across. Well, that's impossible because the size of a single pore in the cage of the zeolite is right around 1 nanometer. So if they're 0.9 nanometers across, they're smaller than the hole in the cage. How is that possible? And it tells them they clearly don't understand the research. They clearly don't understand the science. And then time and time again, they bash me and my product, and then they use my published research and my marketing material to sell their products, you know? So I can honestly tell you this, we are by far the best product in the market. We have all the research that everybody else quotes. We are the only truly micronized and activated zeolite in the marketplace. And if there are any particular products you want me to look at, I'll be happy to, but everybody else is really just a cheap knockoff. Did I get it?
Okay. All right. There's about 3 or 4 questions that people want me to ask you, and then Chip, I think you had some questions too. Yes or no? Yes. Okay. This one I know this answer to, but I'm going to let you answer it. If you have metal pins and such in body, will detox affect them negatively?
No. No. I try to tell people that the zeolite is passive. It doesn't have any active chemistry. It just is this cage, this highly negatively charged cage that floats around the body. And when positively charged compounds get close to it, or volatile organic compounds bounce off the surface of it, it'll trap them. Okay, so metals will float in and float out, but it's not going to attach to like a metal pin or a metal joint and start pulling the metals off. It doesn't do that. It's a very slow, passive process, which is why it's such a great way to detoxify. You take it consistently, and over time, it's going to start lowering and lowering and lowering your body burden of volatile organic compounds and heavy metals. A nice, safe, effective, diligent way to detoxify. And so, no, you don't have to worry about metal pins. You don't have to worry about artificial joints or limbs. It's just not good. That's not the way it works. It's not going to do that.
Okay. Next one, because you had talked about Chernobyl, somebody wanted to know if would it help with the effects of radiation other than a healthier body type of thing?
Well, there's difference between radiation and the effects of radiation. Okay. Right. So organic material can't be radioactive. What happens is we breathe in radioactive particles. Those radioactive particles are spewing out radiation, which causes oxidative damage, causes free radicals. And that's how radiation works. Even for radiation for the treatment of cancer, the purpose of that radiation is to create free radicals, which hopefully destroy the cancer, but it destroys everything else too, which is why when you have radiation therapy, they tell you not to take antioxidants because it actually gets in the way of the radiation therapy, right? So if the effects of radiation are free radical damage, and the zeolite does act slightly as an antioxidant, as a different sort of antioxidant, actually wholly captures some small oxidative species. But I would recommend using, if you really want to have antioxidants, take a good antioxidant supplement along with the zeolite, and they're synergistic. Because most antioxidant vitamins, for example, like A, C, D, E, beta carotene, they work by either donating or accepting an extra electron over and over again and help quell that free radical reaction. Whereas the zeolite captures wholly small reactive species. So two different mechanisms that lead to the same result. So you wind up with a synergistic benefit. So anytime you take the zeolite with an antioxidant, you're getting much, much better results. Okay. And then there are radioactive species that are heavy metals that are directly removed by the zeolite. What we saw with Chernobyl is cesium and strontium, which are the two major fallout products from nuclear power. We saw that with Fukushima in Japan. And in fact, right now in Japan, you can look it up. They actually make clothing with the zeolite impregnated into the clothing, and they make face masks with the zeolite in the face mask because they're trying to prevent any fallout that's still in circulation in the air in northern Japan from getting into people. Okay, so they use the science of the clinoptilolite in an effort to stop those particles from getting in, which can cause all sorts of radiation damage if they get in the body. We've also done some small studies, in vitro studies with depleted uranium. And so if people don't understand this, one of the side products of nuclear power is depleted uranium, which is a very heavy metal. And the army uses it, or the military uses it in weapons, in bombs, and all sorts of demolition equipment, because it's so heavy that when they put in a bomb in the same space, it's much heavier and can be used in like bunker blasters and things like that. So if you're anywhere where munitions are going off, or explosives are going off, there's a chance you're being exposed to depleted uranium. And so we saw soldiers coming back from Iraq and Afghanistan that had depleted uranium in them. And we did some small studies using the zeolite. We did in vitro studies, and the clinoptilolate, the activated clinoptilolate, was really, really, really good at pulling that depleted uranium out. So we know for these particular people, we saw great results. Okay.
Two more quick questions. One from Deborah. She wants to know, does it help with fibromyalgia or burning mouth syndrome?
Okay, so they're both syndromes. I try to say that fibromyalgia is not a disease, it's a syndrome. So in the late 80s, all these rheumatologists got together and they say, we're going to list out 23 symptoms. And if the patient experiences any 9 of those 23 symptoms, we're going to call it fibromyalgia. So there's lots and lots and lots of subtypes of fibromyalgia. But the one underlying thing that we've seen across the board in fibromyalgia patients is magnesium deficiency. So in many, many, many cases, if I just get a good magnesium supplement to a fibromyalgia patient, they feel worlds better within a few months, you know? And so will it help fibromyalgia patients? Certainly it's going to help with better deposition of calcium and magnesium, which is probably going to help those patients. But I do recommend anyone with fibromyalgia get a good magnesium supplement, like magnesium with malic acid, magnesium malate, and get about 400, 600 milligrams a day. And that'll give a world of difference. Burning mouth syndrome is, there's actually several types of burning mouth syndrome, but it's some are physical, where there's actual blockages in the salivary glands, there's blockages in the nerves around the mouth, and there's blockages in the transducence nerve, one of the cranial nerves. A lot of that is inflammation, so anti-inflammatories usually work. And then there's actually a form of burning mouth syndrome that's related to Raynaud's phenomenon, where change in temperature causes it. And that is also neurological, but sometimes considered autoimmune. So I don't know if it would help. We haven't seen patients with that in the zeolite, but I would hazard to guess it would probably be beneficial, because if it is autoimmune, we're immunomodulatory. If it is inflammation, we're anti-inflammatory. So however you slice it, we should have some benefit.
Okay, I know I get some more questions, but we're running out of time, and I know Chip has some. One more question, and it's pertinent. Is the product FDA approved? So could you explain the difference to them?
Yeah, it's a dietary supplement. No dietary supplements are considered FDA approved. Okay, it's under GRAS, generally recognized as safe. So the ingredient, clinoptilolite, is a GRAS ingredient in the United States. It's generally recognized as safe at the dosages we supply. And zeolites are used for all sorts of things. They're used as additives, used as thickening agents. As I said before, there's a product called Quick Clot that's used on the battlefield. It's just a bag of zeolite that they throw into a wound to clot the wound. So it's things that it's used a lot. But dietary supplements by definition aren't FDA approved. And that's why you can't make claims as to the treatment or prevention of any symptom or disease, because they're not drugs, they're dietary supplements. And the claims we make are what they call structure function claims. The product aids or benefits the structure or function of a healthy body or body part. And so we try to stick to those claims. Every once in a while, I will throw in research that has been conducted that might show how it might work, especially when it comes to some of the testimonials you hear. But those aren't specific claims on the product. That's just research on clinoptilolite as a zeolite product.
Okay, I wasn't going to ask this question, but this is my only chance to try to stump you. Somebody wants to know, and I may have to have you read it, but somebody wants to know if it would help with someone who has been diagnosed with aortic ectasia.
I got to read it. You're probably pronouncing it wrong. Where is
I'm
it?
absolutely pronouncing it wrong.
Is it in the
I'm
chat?
pronouncing it in Brooklyn.
Aortic ectasia. Okay, I don't know the condition, but I'm guessing it's something to do with their aorta, and ectasia is inflammation of the blood vessel. So if they have inflammation of the aorta, I'm going to look that up though, so I don't get it wrong.
All right, everybody else, I apologize if we're not going to get to your questions. We are going to try to have Rik on every, 4 to 6 weeks, so that, that we can go through more and more questions.
Okay. It's
So,
dilation
Chip?
of proximal semi-aortic and aortic annulus. It causes aortic regurg, thoracic aortic dissection, aneurysm, and rupture. Okay, so it's an underlying condition that can lead to aortic aneurysm. So people know the aorta comes from the heart, but after it comes from up and from the heart, it goes straight down. Okay, and there's a lot of people that right around here in the middle of the body, they can get swelling of the aorta. That's called an aortic aneurysm. And it used to be that if it was just a little big, if it was like 1 or 2 centimeters, they'd go in and operate. But now we know that aortic aneurysms are very common. They can get up to about 3 or 4 centimeters without really having a problem. And most of the time, if you're diagnosed with an aortic aneurysm, they want to just watch it. If it gets to 3 centimeters, they'll go in and operate. They can put in a cage to support it. They can resect it. The problem is, don't ignore it, because if you have that problem and it bursts, that's called an abruptive aortic aneurysm, or a AAA, and it can lead to death. A AAA can lead to death, and they'll call it a AAA, or an abrupted aortic aneurysm. There's so many causes of aortic aneurysm. Most of it's genetic. I don't know if we'll have any benefit in that. The only thing I've ever seen with those sort of blood issues or the vessel issues is the use of things like vitamin C, which helps build stronger blood vessels. So anyone that has aortic aneurysms or any kind of issues like this, I just recommend taking 1,000 milligrams of a decent vitamin C daily. And of course, like I said, take the zeolite with that. It makes everything else better anyway. Okay. I did want to give Trisha one more bit of advice, though, especially because she talks about weakness. I worry about loss of lean muscle mass. So as you're using the zeolite, I don't know what your normal diet is like, but I would like you to add a good protein powder with branched chain amino acids to preserve lean muscle mass and prevent catabolism. Especially as you get more and more active, you can actually start losing lean muscle mass. And so there's plenty of products out there. So look for a good protein powder with branched chain amino acids, BCAAs, and try to drink that as a shake, 2-3 times a week. I think it'll do a lot to improve your energy. Okay, so Chip, do you have? I'm sorry, we're running out of time. I don't know, Robben, do you want to keep going? No, Chip, do you mind if we pass on you till the next time? Unless you have something really important.
Go ahead. No, I mean, we can go ahead and take Chip, and then I think, the rest of the questions, we'll make sure that we write them down, and we'll get them either emailed to Rik or ask them the next time.
Great. I just know we're getting along. Go ahead, Chip. It's all you.
Yeah. Okay. Well, actually, this might be a good way to end. And I just wanted to ask this one thing, Rik, maybe to drive in all the points you've already made. And that would be, why not to quit using it, and the benefits of lifelong use, of very long-term use. I mean, obviously on this call, many of us that are in that category are here, and we'd be good examples of it. But if I could ask, why not to quit, and the benefits of very long-term use?
That's a great question. I love when I give this lecture. And of course, in the days of COVID, I'm not doing large lectures anymore, but I used to be in rooms of thousands of people. And invariably someone asks the question, when can I stop taking it? And I asked the question, okay, by a show of hands, how many people here eat? How many people drink? How many people breathe? And then of course, at some point I say, who's not going to raise their hand no matter what I say? The fact is, we all eat, drink, breathe. We're bombarded with toxins on a daily basis. So the food, the water, and the air. And there's no time that you shouldn't be taking this to try and reduce your body burden. Okay. I do recommend, starting at a detox dose. You take more at the beginning. You can lower it to a maintenance dose over time, repeating the detox dose every 6 to 12 months and trying to just keep clearing yourself out. Now, when you start talk about stop taking it, the only time I really have that conversation is when people have some sort of negative side effect. So about 1/10 of 1%, about 1 in 1,000 people is going to have an adverse effect when they start taking the zeolite. And those people are incredibly toxic. And what's happening is, because they have such a high body burden, when they start removing some of those toxins, the toxin sequestration, there's so many of them, they're bursting, that the body goes, wow, we're removing some of these toxins, just starts to let them go. And next thing you know, you have a flood of metals and volatile organic compounds in circulation of blood and lymph. And that can cause what we call a detox syndrome or detox crisis or wasting syndrome. It's basically what's happening is now all these toxins in circulation are causing a lot of damage. And it can feel like flu-like symptoms, fatigue, nausea, it could be GI distress. And like I said, it's very rare, but when it happens, it's a clear indication of a highly toxic individual. At that point, people say, why stop taking your product? That is the worst possible thing you can do, because now all these toxins are in circulation. I would recommend lowering the dose, but you have to keep taking it so you can clear those toxins out that are in circulation. So my recommendation with those people is usually either keep it taking a high dose and bowl through it, get through it, drink plenty of water and take plenty of zeolite, and you will get through it, but it will be uncomfortable, or greatly reduce the dose, even 1 or 2 drops a day, or put a few drops in a bottle of water and drink it through the day, and work your way up over time as you detoxify. So but the worst possible thing you can do right there is stop taking it, because now all these toxins are back in circulation. They'll cause all sorts of damage until they resequester. Okay. And like I said, why should you keep taking it? Because we're bombarded by toxins on a daily basis every day of our lives. We want to do everything we can to lower our body burn, lower that toxic effect, so our body's a cleaner, healthier body can fix itself. Good.
Okay, great. Rik, thank you very much for your time today. We really appreciate it. Robben, would you like to close it out?
Yeah.
Oh, wait, one more quick thing from a business standpoint, okay? Those of you who have not heard it, starting tomorrow and Sunday, we are going to have 20% off every item, including the zeolite and detox, Saturday and Sunday, to end the month, right through the close of the month, starting tomorrow morning, I think 10 a.m. Central. So let's go out and kill them, all right?
Awesome.
Get the stuff you need.
If anybody has a question that didn't get answered, just email them to me. We'll make sure we get to Rik and get you an answer before next call that we have him on. Thank you so much, Rik. Thank you, Trisha. We appreciate everyone that shared and asked questions. And Rik, especially for your time. We know you're very busy. Thank you for all your time that you put in. And we're so glad that we're here with NAVAN and the Daily Detox. We're very, very excited. Thank you so much.
My pleasure. Thank you. And Trisha, thank you.
Thank you, Rik. Good job, my friend.
Thanks, Rik.
Thank you, everybody.
Rik.
Thanks, Rik.
Thank you, guys.
Thank you, Rik. Thank you.